Well, Dr. Sarah Oreck is a psychiatrist and therapist who focuses on women's mental health and wellness. She joins me now with her take on the trial. So, Sarah, we've been talking, since this started, and we've now learned that over 4 months, Lindsay Clancy was on 13 different psychiatric medications. Is this normal? And what are the risks involved when you mix meds like this, and so many of them?
Well, I think what's so important is that she was on 13 medications, but it seems to have been a lot of trials, starting and stopping, and sometimes not even taking a full course of the medication. Unfortunately, what this really tells me with the various clinicians that she saw is just the fragmentation of psychiatric care that so many women face in this country. She wasn't getting what she wanted or what she needed from one provider, so then she went to another, really making a very confusing picture. And what was interesting to see her husband on the stand not recall if she had a therapist and not really following all of her care. And this is where I think it's so important for this to be a family treatment. This is not just about the woman that's suffering. It really is a family system that's suffering.
Yeah, you need someone by your side loving you and looking after you and trying to, guide you through the process.
Yes.
So postpartum psychosis. Let's talk about how it can cause delusions and losing touch with reality, and how that can lead to extremely dangerous behavior.
Absolutely. This is a psychiatric emergency that's so important to talk about because many people have experienced postpartum depression and anxiety. But psychosis, postpartum psychosis, is really where you have breaks with reality. You also have in and out of consciousness. So it's really very different. And again, if you hear a family member, a woman that's postpartum, having any paranoia, delusions, or just seeming kind of out of it, like she's not as sharp as she normally is, she's confused to time and place, it really is time to call 911 or go to the nearest emergency room. And of course, for Lindsay, it sounds like she had auditory hallucinations, which some people experience, but not all have to experience it. And really, it's very important to note that people can get the treatment that they need. And infanticide and what happened here happens very rarely. We just seem to always televise those cases. 98% of the cases that get the treatment that they need, all of the cases I've ever seen throughout my career, go back to having stable lives and don't ever harm their children or their loved ones.
And that was my follow-up question, that on the right meds, on the right treatments, moms can live healthy lives, right? And with the right
go back
meds.
to their baseline. Yes, exactly.
That's what I wanted to ask. Can the postpartum psychosis actually come to an end?
Absolutely. And that is what we see. Obviously, for some people, they have maybe an underlying bipolar disorder. So potentially, sometimes it may occur. And certainly in subsequent pregnancies, there's a very high risk of postpartum psychosis. But when you get the proper treatment, which includes mood stabilizers, antipsychotic medications at the right doses, you can get better. And I've seen many women go back to their jobs, go back to being the mom that they used to be, being themselves. And I think that's the most important story, because that kind of gets lost in this, in incredible tragedy that is this case.
Oh, and this is why I keep wanting to bring you back, because you're answering all the questions that we all have, and you're putting it into much of a clearer perspective for us. And as you know, we've all been hearing from family members testifying that Clancy was begging for help, saying that her medication wasn't working, that she was feeling worse. How can doctors determine whether a medication is actually helping or making, the psychiatric symptoms worse?
I think what may have happened here is that she may have had some aggravation of the symptoms with, for example, the first SSRI that she had, that selective serotonin reuptake inhibitor. Those are fluoxetine. These are the very common medications that people are on, antidepressant medications that can sometimes make insomnia, agitation a bit worse, which is maybe part of what was happening. I think it's really important that someone find a trusted provider. And unfortunately, we also need more clinician education around postpartum psychosis, and that this can be an emergency. And again, I think there may have been some gaps in the knowledge that maybe some of these clinicians had around this specific issue, as well as some bias. This woman is a white nurse. She's well presenting. She seemed very high functioning at times. And sometimes those characteristics make you think, oh, she'll be fine. There won't be any issues here. And, she was complaining a lot. She wasn't getting sleep. And when your patient isn't getting sleep for days, those red flags have to go up, because that's when you start to see tragedies happen.
Well, I'll tell you, if she had gone to you for treatment, things may be completely different right now. We just really appreciate your knowledge and your insight, Dr. Sarah Oreck. Thank you so much.
Thank you so much for having me.